The COVID virtual ward is something that we set up to support people who've got COVID or who we think have got COVID who are at risk of getting worse. The idea of it is to pick up patients who are unwell but don't realise how unwell they are, and we can pick the issue up at a point where we can treat them more successfully and save lives.
What can happen in COVID is that usually between days 5 and 10, if it is going to happen, people can become more unwell, but with this thing called silent hypoxia, so people don't always realise how unwell they are becoming, and the only way to pick that up is with a pulse oximeter.
So patients are given a pulse oximeter so that they can then monitor their oxygen saturations and their pulse readings. They do these twice a day and submit them to us. We look at the readings. If they are not in the normal range, or if they have worsening symptoms such as a cough or breathlessness, then we will call them to assess them.
You receive your monitor and there's a little leaflet in there telling you how to use it. And it's literally as simple as you put it on your finger, you turn it on, you let it sort of settle down, and then you read out the numbers that have settled on the monitor.
It just gave you the confidence that you were on the right track and everything was going forward, and you weren't on your own. They were there reassuring you every step of the way.
Actually, I felt really quite safe and reassured, and a doctor was on hand. It was actually fantastic. Service was fantastic.
So I think there's several elements to success. There's the fact that we've had more than 1,000 people through the virtual ward, which means that we've had more than 1,000 people with the reassurance that they know someone's looking after them, someone's keeping an eye on them. We have been able to admit quite a few people early in the course of disease and get them home safely as well. So there's success on both counts. It's identified people who needed to be in hospital, so it's undoubtedly doing what it's supposed to do, but also it's allowed that reassurance that people aren't just left alone having been given this diagnosis.